Every 15 minutes, one person in the US dies because of an infection that antibiotics can no longer treat effectively. This crisis isn't limited to the US. It's a global crisis. 700,000 people around the world die of drug-resistant diseases every year. And if we don't make a radical change now, that could rise to 10 million by 2050. So what is antibiotic resistance? Antibiotic resistance is a global public health concern that affects people of all ages and backgrounds. It's caused by the overuse and misuse of antibiotics, leading to the development of superbugs that are resistant to multiple such drugs. This happens because bacteria evolve quickly to survive exposure to drugs that are designed to kill them. As a result, drugs that were once effective at treating infections no longer work. This makes infections difficult to treat and puts individuals at risk for severe illness and even death. The World Health Organization has declared antibiotic resistance as one of the top 10 threats to global health. According to the WHO, it causes at least 700,000 deaths per year worldwide, and this number is expected to rise to 10 million by 2050. This is a staggering statistic that highlights the urgency of addressing this issue. We are quickly approaching a point where antibiotics will no longer protect us from the threats of disease. Drug-resistant superbugs, created by our own overuse of antibiotics, have already started to become an inevitable reality, threatening both public and animal health alike. From tuberculosis to STDs, infections are becoming increasingly resistant to traditional treatments, where two alarming instances currently pervading our landscape include supergonorrhea and C. difficile. As drug resistance becomes more rampant, routine medical procedures such as C-sections and joint replacements will become riskier, and we will no longer have the means to protect people with compromised immunity. This includes premature babies and people who are undergoing chemotherapy. Despite these risks, the misuse of antibiotics remains rampant. Doctors are prescribing them for viral infections where they won't provide any benefit, and industrial farmers are continuing to use them in large amounts to compensate for substandard industrial farming conditions. Antibiotics are also often used in animal feed to promote growth and prevent disease. This leads to the development of antibiotic-resistant bacteria in animals, which can then be transmitted to humans through the food chain. Without a drastic change in how we manage this issue, it's only a matter of time before these powerful medicines stop working altogether, leaving us all at risk. Antibiotic resistance doesn't only affect human health, it also has a significant impact on the economy. The cost of treating such infections is higher than the cost of treating non-resistant infections and puts a strain on healthcare systems and on insurance providers. In addition, the loss of productivity due to illness and death caused by antibiotic resistance also has a significant global impact. So what can we do about it? 1. We can prevent infections from happening. Stringent infection control measures in healthcare settings can help reduce the spread of antibiotic-resistant bacteria. These include hand hygiene, the appropriate use of personal protective equipment, and cleaning and disinfection of surfaces and equipment. Doctors should also ask patients about recent medical care at other facilities or travel abroad and administer suggested vaccines where appropriate. To prevent infections at an individual level, practice good hygiene habits, including hand washing and safe sex. If you're traveling, get appropriately vaccinated before you depart and be mindful about what you eat and avoid ingesting suspect food and drink. Secondly, create systems that encourage responsible antibiotic use. Governments and international organizations must work together to address antibiotic resistance by implementing policies and regulations that promote the responsible use of these drugs, and also by investing in their research and development, so new drugs and diagnostic tools can be created. Thirdly, stop the spread of resistance when it develops. Healthcare providers must be aware of when to report cases to the health department so a containment strategy can be implemented if required. In one case, for example, a patient in Orange County, California, tested positive for C. auris. This is a multi-drug resistant yeast that can lead to fatal infections. To contain the threat, the CDC screened hundreds of patients and put anyone infected under special precautions. This helped prevent the spread of this dangerous yeast to other vulnerable patients. Lastly, say no to taking antibiotics unless they're necessary. This includes saying no to consuming animals raised on factory farms. The responsible use of antibiotics is essential to combat antibiotic resistance. This means taking antibiotics only when they are truly needed and taking them exactly as prescribed. According to estimates by the CDC, almost 30% of the 47 million antibiotic courses prescribed annually by US doctors and emergency departments are completely unnecessary. Healthcare providers and the agricultural sector can slow down resistance to antibiotics by only administering them when they're actually needed, bearing in mind guidelines for their proper use. You can also ensure that you're not being given antibiotics unnecessarily by questioning your doctor about whether or not there is a need for them before you start a course. If you have a cold, flu, or traveler's diarrhea, for instance, ask your doctor whether it is really a bacterial infection that requires antibiotics for treatment. Given the health threat that we're all under if antibiotics stop working, why don't we just develop new ones? Simply because developing new antibiotics is much more complicated than it sounds. According to experts from the CDC, scientific obstacles and limited business incentives are major hurdles in the development of new antibiotics. So much so that between 1962 and 2000, no new major classes of antibiotics were approved to treat common and lethal infections. 78% of major drug companies have reduced or discontinued antibiotic research altogether since 1990 because they lack the necessary financial incentives to continue conducting research in this domain. This is because it takes many years and a lot of funding to carry out the necessary research and development required to bring a new antibiotic to market. And more often than not, new drugs fail. Even if a drug is successful, however, it's not very profitable. Antibiotics are usually intended to be drugs of last resort and don't bring in as much revenue as medicines that must be consumed regularly. Consequently, biotech companies are left without sufficient financial incentives to continue their pursuit. In addition, bacteria evolve quickly to develop resistance to new antibiotics. They reproduce every few minutes, and as a result, evolution in bacteria takes place much faster than it does in humans. Bacteria acquire resistance to antibiotics through mutations that occur in their DNA, by acquiring resistance genes from other bacteria, or by developing biochemical pumps that can remove the antibiotic before it reaches its target, or enzymes to inactivate the antibiotic. Drug resistance is a global challenge that affects high-income and low-income countries alike, and according to the UN, we must look beyond traditional market models for solutions. Antibiotics must be classified as public goods necessary to maintain social stability, much like infrastructure or national security. To properly address drug resistance, then, we must invest in research and development and shift our focus from free markets towards government funding initiatives in order to do so. However, it is likely that for governments to mobilize around this issue, we might first have to see it being pushed as a priority by the general public, which is highly unlikely to happen. What's scary is that by the looks of it, many might have to die before we start to see the necessary response. Rounding up, antibiotic resistance is a global issue that requires a global response. By working together and taking steps to promote responsible use of antibiotics, investing in research, and implementing infection control measures, we can help preserve the effectiveness of these drugs for future generations. It's also crucial that we act now to combat this growing threat to public health and to the economy. If you enjoyed this, please don't forget to give it a thumbs up. Do subscribe to our channel to stay tuned for future videos. You can also support me by buying me a coffee. I'll put the link down in the description box below. Until next time, bye bye.